Welcome to the Healthyism Podcast, a panel discussion on trends and innovations in health and self-care. My name is Christophe Jauquet. I'm the author of the Healthyism books and a professional keynote speaker on health, business, and technology. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, we have two of your beloved experts in the panel. From Scotland, but living near Brighton, medical expert in digital innovation, Dr. Keith Grimes.
Fit like everybody.
And last but not least, from Ghent, Belgium, human experience expert, Zouina.
Hello, Chris.
Hello, Chris, indeed. So in this week's episode, one of you will bring a trend or an innovation that sparked your health enthusiasm. And then the rest of the panel will debate and share their opinion about it. Is it something, nothing, or everything? And we go to Keith. What sparked your health enthusiasm this month?
So, my health enthusiasm this month was looking at low-tech, a way of helping children with cancer connect and write letters to pets and animals. But I suppose the something, nothing, or everything aspect is not so much about innovation, but the absence of innovation. And so I'm going to dwell on the world of child health again. And in short, there is not enough innovation or even support for child and adolescent health and wellness. Why do we know this? Well, I mean, maybe everyone can reflect on their own experience of this. If you have children or have children in your lives in some way, you'll probably already be aware of what sometimes can be a bit of a gap in that area. Now, if we look at the facts, here in the UK, in the NHS, we've had a change of government recently, and Lord Darzi wrote an investigation very rapidly about the current state of the NHS. Long and short of it, the NHS is in a critical condition. Why is this? There's a lot of different reasons. But if we look specifically at children in this area, this is an area where there's a big gap. 25%, 24% of the UK population is children. 11% of the healthcare budget is spent on them. For a start, there's not enough funding in there. And health needs, in particular mental health needs, are growing. One of the statistics, since 2019 and now, there has been an 82% increase in eating disorders in children. This is bad news. Rising need for educational support for emotional, social, mental health needs, and waiting times. Children are 13 times more likely to wait more than a year for mental health support than adults as well. Vaccinations are falling. Deprivation is causing more problems as well. This is a difficult time for children's health. And you think, well, the demand is there. Surely the innovation should be there. But it's not. So Professor Susan Shermaldine, who is a child imaging specialist at a recent talk, talked about this and said that pediatric technology, or PedTech, is lagging adult innovation on average by over a decade. Less than 3% of commercial AI radiology tools that are regulated in the US are for children. This is another big gap. And the strange thing is that children tend to be more interested in this. They have higher trust levels in the use of innovation and technology, in particular AI, for this as well. So we have a gap. The demand is high and growing, and the solutions are small. And this is a problem. And I'd love to open it to you and say, well, why do you think this is?
Why? Do you know why, Mo?
Well, in terms of percentages, maybe that's a good thing, because that means that the onset of disease is more represented as you age, and that the relative care for children is not as urgent. Well, not as urgent, don't take it literally, but the incidence of disease, of the presence of disease occurs more and more as you age, the 24 and the 11%. Maybe that could be a good sign. On the other hand, when we talk about pediatric care, we have the tendency to look very close to us, but there's two dimensions: pediatric care in the Western world and pediatric care in the underdeveloped world, where we have completely different realities. Birth rates are different. The state of health is different and things like that. So I think if we go back before the children were there were parents. And I think we need to look maybe back rather than forwards to solve the problem. Pediatric care will be tightly related to the type of world we leave behind for our children, but also the type of education we leave behind for our children and the type of diseases we leave behind for our children. Climate change, we know, we are creating the world in which we live in, and we are creating it in the Western world and having children in the underdeveloped world pay for it. But also obesity and mental health. And maybe we need to look back, and what I see is that we as parents, and I include myself, I'm not the ideal parent at all, we tend to outsource education and health to the system. So maybe the best thing we could do for pediatric health is to have parenting skills increase. Because when you look at obesity, when you look at mental health and things like that, the things where the children live is their ecosystem. Can we have parents create more value in the ecosystem where children live to alleviate the pressure on the system? So I think our ability to really care for ourselves and for our children, being better adults, being better parents and things like that is very, very important. We see it too much. You blame you blame schools for not educating your children. We blame the system. I can give you a real example. 2 years ago, I was on a holiday, and a very good friend of mine have a girl. She's 14, but she's really tall and quite solid. Let's say that. And she says, "Mo," because she knew I was involved in behavioral design. Is there anything you could tell her? You could tell her to stop eating junk food. And I said, what do you buy? What is in house? Yes, but in the morning we don't have any time and things like that, and cornflakes and Nutella and things like that. So how do you want me to tell your daughter, create the environment that is healthy for her? So we kind of de-responsibilize our the future of our children. So I think the direct thing I think that would really scale is helping parents be more responsible with the education and the health, and also equip them with skills that are better. Not easier said than done. Secondly, I also have a question on the future of pediatric care with dwindling birth rates, fertility, and relationships. Is it going to be a segment that is going to be underserviced because a lot of physicians won't choose pediatric care anymore? Because in terms of the business model, there'll be less people to service and to care for. So that's a question I'm just, putting into the group there. So I think two things. Looking at the future means looking at today and looking back, and who has the biggest influence on children, which is parents. And then secondly, how is this segment going to evolve in the future with dwindling birth rates, fertility going down, contraception use, but also, the state of relationships and loneliness, and people having children later and later in life, which can also create a lot of health issues. So that's an open question.
Yeah, so many factors in there. Christophe, do any of those, what would you add to that as well? That's there's the market forces driving it and society. Well, Christophe, what are you taking into it?
Well, I think you're circling back to your question was, why is it that pediatric care has less attention? And if you think about it, if we talk about the future of health and healthcare systems, we mostly talk about the elderly population and how it will not be sustainable financially, how we won't have enough resources to take care of them. So we're always thinking about the older people, which is kind of logical because the people that talk about are the ones that are, already in an age where they're all almost considered elderly, let's put it that way. So we're always focusing at the older people. Well, if you really forget about the younger people as well. And actually, if we think about the future of health, we should be focusing a lot more on making our children healthier, because they are the future of health, literally. Maybe we should care less about the elderly and more about the youngsters. And you mentioned a lot of numbers there, and I can even add some more, but I'll skip that for now. But I think the most important thing is that we need to take into account that we need to focus on these children, and it's happening a little bit already. We're talking about mental health. Did you know that actually the subjective well-being of children, youngsters, just until 15 years ago was not even measured or researched? So most of the time when we were looking at the subjective well-being, so the personal assessment that children have of their own well-being, was only done through their parents. So people assumed that there's a great correlation between the well-being of parents and the well-being of children, but that is not always the case. And it's only since 15 years that there's actually a real clear focus on how does that involve. And if you look at the pictures in those 15 years, the overall well-being, the personal assessment of children themselves is indeed decreasing massively. And with COVID, it even had a downward spiral during a certain moment. And in this case, I'm really talking about the Western world, the developed world. In other parts of the world, we see it rising children, but in our like Europe, the Americas, it's totally decreasing. So I think we really should be focusing a lot more on these children. And I think we just focused on elderly because it's about the financial system. It's because the elderly are talking about it, and that's about it.
Yeah, these are all great points. And Mo, in particular, your sort of description about, the falling birth rates in the Western or high income countries versus what are actually ballooning fertility rates and, rising numbers in the low and middle income countries. So I think, where you get the greatest impact on the future generations that will inherit the earth that some of us will leave behind, it makes sense that whatever we do, we maybe want to focus more on those areas regardless. I think, we've talked about the finance challenge and the sort of drivers that might cause investment to go certain ways. But, even coming back to the sort of clinical and technical challenges, simply put, children aren't just small adults. Children are different creatures. They evolve very, very rapidly as well. And so you can't just take a big device and just shrink it down and put it into a kid. Same with drugs as well. And then how do we then, if we're talking from the medical perspective, show that these are effective and safe when these are very small populations to study? Very, very high kind of ethical challenges about how you recruit into this area. A lot of things are stacked against anyone who wants to work in this area to do so. So I think it's important to recognize that, it's not just simply saying we should do better. We've got a lot of things and challenges in our way. And, how we solve it was I was thinking about this subject coming into it. There's some interesting developments. It's all about, at least from the health side and the kind of clinical side, growing trial networks that focus on this to sort of specifically look at pediatric health concerns to make sure that the funding, particularly grant funding, flows into this area. The money flows into this area. The research follows as well. Pediatric device consortia are coming together so that they can start sharing what they're learning and help accelerate development in that. And even down to how hospitals are configured, about the infrastructure within a hospital to allow them to be partners with industry and people working in these areas are all important parts about how we start to solve this.
I have a great example there. I don't know if you're familiar with Riget in Denmark. It's a pediatric hospital. And I always use it in my keynotes because I think it's one of the most amazing examples in hospital experience. What they did is over a period of 2-3 years. So they knew they needed to build a new hospital. And just instead of building a building like we always do for hospitals and then packing them with beds, what have you all, is what they did is over a period of 2-3 years, they did workshop researches together with nurses, physicians, parents, and children. So I think they did over 100 different types of your typical market research, design thinking type of exercises to really identify what a hospital should look like. And you can find it online. Like, by the way, Riget is Children's Kingdom in Danish, if I'm not mistaken. And you can find it online, all the results of those researches. It's a PDF of 120, 150 pages, perhaps even document that describes all the different experiences that they come up with. And I think the document starts by saying, we were looking on how to build a new hospital, but what we end up with definitely is not a hospital. So, which is nice. And I think when it comes to healthcare experiences, even if there's less focus on the importance of health for children and how we should be looking at it from a more macro perspective, I think from a micro perspective, I think we're doing not too bad. I mean, in general, in my experience, the health experience in pediatric hospitals is way better even than in general hospitals. But I really like this example of Riget. I should look it up.
Mo, this sounds like your territory as well. It's like, once again, it's like, if we listen to the stakeholders, and who's a key stakeholder here? The child. We start to think much more creatively and we end up with a solution that, surprise, surprise, might actually fit the end beneficiary.
Yeah. I think we have a good example in Ghent. It's Elizabeth. We have a separate department, child hospital. They have also done a specific TV series on the Elizabeth faculty within the University Hospital of Ghent. Yeah, I think the overall experience, but also the integration of parents in the care of their children is really, that inclusive part also, because it's a bit like a Pampers, one person is treated, but two are suffering. And I think the integration of the parent, you make a pamper for the child, but you want the parent to have a good night. So I think it's the same approach. And I do agree that as fertility rates are dwindling, a child will become a very scarce and valuable resource because a lot of our future depends from it. So maybe indeed, Christophe, maybe the opposite might be interesting, is that we have to shift funds because we won't find new funds. I'm listening to you, Keith, and separate research and the critical mass. We see a fragmentation, whether it is medicine between men and women, medicine and clinical trials for people with different ethnicities, because some tests work differently, some drugs work differently, and now we have another fragmentation. I think what I agree with you both is that choices have to be made to shift some funds to pediatric care because the future depends on it here.
Christophe.
Yeah, and I think, earlier you were mentioning on that we need to educate people and definitely the parents a little bit more, and that we need to create more awareness around it. There's one organization that I always follow that I like really a lot, who look at health in a different way, and that's the Global Wellness Institute. They do a lot of great stuff. And one of their initiatives is called Wellness for Children. And it's really a collaboration of multiple stakeholders, mostly people from the wellness industries, that want to create awareness of the need for children and young people to be actively involved in their own wellness. And so definitely when people or children reach their formative years, the 10 to 20 years old, they're looking for ways to really teach them about the benefits of being healthy, so that actually people have, or children have, less chance to develop obesity or type 2 diabetes, heart disease, whatsoever, maybe even cancer. And so they have a lot of resources on the matter that you can include in schools, that maybe parents can include. They have a lot of materials that you can download. But they also have every year an overview of all the trends in the space, because the Global Wellness Institute is very much specialized in wellness trends as well. And so they have a specific part of their trends that is dedicated to these, wellness for children types of areas. And so they really explain what is happening, what should we be careful about, where is it going, what should we be doing. And I think this is it's a small initiative coming from a non-for-profit, but I think we should have more people, maybe even people from the healthcare industry, joining these kinds of wellness initiatives to make it, more strong, more widely distributed, perhaps even.
Yeah, Mo.
Mm-hmm. Well, the question is, where does the term child stop? Because as adolescents, there are social codes that drive children to more risky and unhealthy behavior. I did a study once, not a study, I analyzed in the American colleges and universities, there's a lot of campaigns about meningitis, right? Because it's very transmissible and it happens when people live in close quarters and everything. And what I found out by analyzing the data is that all these youngsters knew exactly what risk behavior was. But there were social codes that did not allow them to follow up on the behavior to avoid that risk, because there were social codes, there was risk taking and things like that. So they all know what is dangerous, but they're not able to show safe behavior, or less in the inhibition to risky behavior. So I think in the wellness report or the wellness indicator, that's also something that is very dynamic, and behavior and risk-taking and risky behavior or unhealthy behavior is a spectrum that evolves over time. And awareness is one thing, but also integrating who they are, what the social codes are, right? And what often they do for the environment. Now, what is very interesting is I have a 27-year-old daughter, and what is interesting is she likes a glass of wine. She will never allow someone to take the wheel with a glass of wine. So, and that has changed interest. That has been changing incredibly. So I'd love to see that spectrum of behaviors, wellness, and things like tracked on a kind of time scale, and have tools catered to that specific environment where they are. I think that's really important. So what is the What is the continuum? Where do you stop being a child, and how can we cater to them in their specific life periods with the challenges they
Yeah.
have?
This is really good stuff. And I suppose we've heard some really good examples as we sort of go past, the big problem and why this might be. And we've actually started to hear some reasons for optimism in there as well. There's maybe a couple that I might share back. I do a lot of work with companies and startups in this space. And when I was reflecting on this, I thought something that was really nice. There were maybe two examples that I work with specifically and interestingly in VR. I love my virtual reality as well. One company that I advise is called Maxim VR, run by Lisa Frank. And what's really lovely about this is that she has an app that you can get from the App Lab on Quest that provides a virtual safe space, a virtual island for children and adolescents who have experiencing emotional and mental health needs to visit and explore and undertake activities that help mindfulness, gratitude, things like that. This is a personal space for them at this point, but could become social in the future. It's lovely to see this space happening, particularly driven by some of her experiences, but also the experiences of others, that this is a place where they can really interact in this space. And of course, thought on from a medical perspective, this can actually integrate with their medical care. Or equally, ADHD and neurodivergence. We're aware that virtual reality and some practices there can be used to actually act as a digital therapeutic. And another friend of mine, Farhan Amin, a GP from the UK, has A-Health. And this is a service that allows for neurodivergence and mental health assessments. But within that is a space where focus activities can take place, targeted for children, gamified experiences that are not only entertaining and engaging, but can actually deliver evidence-based real-world improvements in behavior and focus activities too. So we are seeing people working in this space as well. And coming back to what we talked about before, why does this happen? It's coming from engaging with these end users and beneficiaries. It's these stakeholders, identifying the problems that they have and working with them to create them too. So I love to see that happen. I love to see more of that happening.
Mm-hmm. I think
what I'd like sorry, go ahead.
No, I wanted to piggyback on that because I always speak about the three ingredients to create a good health experience is you need to answer to the needs, you need to help them with their expectations, and you need to fulfill their aspirations. Now, I think if we need to summarize what we just discussed a little bit, is that I think we know some of the needs, but maybe we ignore them sometimes a little bit too much because we're more focused maybe on the elderly population and other things. But when we put out a solution, and I think there your examples are really valuable, Keith, is that we do understand what their expectations are. These VR solutions are, made for children. These are the things that they expect. These are the experiences that they really expect. So in that regard, I see a lot of good things happening, and your two examples are definitely wonderful. The third one, aspirations, I'm not quite sure, and this is what Mo was saying as well, is that do we really know what youngsters aspire to, and how can we help them to, aspire to be healthy? Because most of the times in those age groups, they're not really aware of it, and they're not really aware of how to take care of themselves, or they just don't, they don't bother to do so. So I think that if you look at these three elements, expectations good, needs not always, life aspirations, how can we make sure that we help them realize what is important to them?
Yeah, great way of framing it.
Keith, I loved your examples, but I'm missing examples where you're not able to do it if your parent is not in the room or in the space or also wearing something. Because I think it's also really interesting that I think if you have a solution and you give it to your child, you kind of de-responsibilize yourself. I would love to see these solutions. I would love to see more solutions where you observe your child and then after the experience, you're able to reflect with your child about it, right?
So interesting.
Yeah. So I would love solutions where the child cannot participate if there's not another person in the room that is the parent, for instance, right? And even if the parent is passive, they're just observing what the reality of that condition or anything is, and then they will take away whatever that experience is. So it would be a nice thing that they both have to push the button simultaneously to start the experience.
So and with that, Mo, And with that, Mo, a new product feature for these has arisen as well. Actually, entirely possible. There's the right place and the right time. And already these solutions have the ability for the parents to track the activities and so on. But, the simultaneous shared experience, the observed experience, wonderful thing about VR, all entirely possible. But anyway, with that, I'll wrap up on that. I think we've got some really lovely ideas going forward. But my call for people is just let's not forget about children, because they're, if anything else, they're the ones that are going to be taking care of us when we need it.
Yeah. Pediatric health enthusiasm, it is clearly something, at least something to pay some attention to. But now time for something else, the end of this podcast. Time to wrap up the podcast for this week. Thank you for listening. If you like this show, don't forget to hit the subscribe button on your favorite podcast platform. You can also visit healthenthusiasm.com to discover the other episodes, subscribe to the newsletter, and learn more about our panelists. For now, I'd like to thank our panelists for their health enthusiasm. Thank you, Dr. Keith Grimes, Mo Zouina. My name is Christophe Jauquet. We are the Health Enthusiasm panel, and we'd love to see you again next week for some more health enthusiasm. Ciao.